Hello, everybody, and welcome to the webinar on the Wisconsin State Budget Briefing for Disability Advocates. And I need to apologize. This is Lisa and my first time, actually my first time. Lisa is on her air personality, so she's probably used to this stuff. But we will go ahead and go through our budget briefing, and if you have any questions, you can go ahead and type them into your computer, or you can text them in your telephone. Is that correct? And we will certainly try and answer questions as we go along. Okay, so Lisa?
So I'm Lisa Pugh, and I work for Disability Rights Wisconsin. John's with the Board for People with Developmental Disabilities. This budget training is being co-sponsored by the Wisconsin Board for People with Developmental Disabilities, Disability Rights Wisconsin, and People First Wisconsin. And thank you for joining us today.
Yes. So what you will learn today is why the state budget is important. Do you want to advance the slide? Okay. Why the state budget is important. What is in the state budget, and how you can have a voice about the state budget. Okay, so why is the state budget important? Next slide, please. It's passed every 2 years, and it includes important funding for the state programs. It also determines how much money will be spent on different things that our government provides. Now, you need to remember, this is not just human services, but this is everything, including roads, education, anything that the state government would provide is in the annual state budget. Okay, the other thing is that there are often different policy changes, like, for instance, long-term care and school accountability put into the budget. And this changes the programs, but they do not seem to be related to the budget because they really don't have a cost impact. Oftentimes, the reason that they're put into the budget is a bill that does have to be passed. And so it's a lot easier to get things through the budget than it is through the normal process.
So here's a chart that kind of walks us through how the state budget becomes a law. There are several steps that have to happen before the budget is actually passed. We're in that second column, so you'll see on the left, those two boxes under the executive branch talk about what the governor's role is in the state budget process. So state agencies have already submitted their budget requests, and then the governor takes that information and puts that into his own budget proposal. And then the process moves to the legislature. So the budget's received by the Joint Finance Committee, and now the Joint Finance Committee is considering what they want to put into the budget. And we're in that second column there in the Joint Finance Committee determining what they want to have in the budget, and they'll be holding some public hearings. So next slide. So where are we at now? The governor gave his budget speech on February 3rd, and so that's when he announced his priorities in the budget. And then we're in this process now where an agency called the Legislative Fiscal Bureau is determining the cost or the cost savings of the different proposals and ideas in the budget. And now the Joint Finance Committee has just announced hearings across the state of Wisconsin, and we will be talking about those dates and how you can get involved and participate in the public input process for the budget. After that, the Senate and the Assembly will vote on the budget, and what we need to know is that this budget has to pass before July 1st of 2015.
Okay, so what's in the state budget? Well, first of all, we know long-term care is in the state budget, and specifically there are different things in regards to IRIS. And do you want to go ahead and do all of the talking points? So what we do know is that the IRIS program in its form is eliminated in the state budget. Okay, this is a self-directed long-term care program. It serves about 12,000 individuals. What it does do is it requires IRIS participants to enroll in new family care if they wish to receive long-term care. Now, we don't exactly know what this is going to be, and this is an issue with a lot of the budget, and especially the long-term care program. We're not really sure exactly what everything means, but what we have been told is that you will be able to self-direct your services in family care. So we do know that. However, we sort of have some questions about that. Are you going to be able to control your whole budget? Will you be able to set the rate of pay that you have for individuals that work for you? We really don't know that. And that's a huge concern for many people with disabilities because, as I've been going around the state, what I've been hearing from people is, when I was in family care, yeah, I could hire who I wanted to hire and all this other stuff, but I had to go through an agency to pay my employees, and the agency would take 45% of the overall cost off of the dollar amount that they were paying, and my employee that I hired was only able to make $9 or $10 an hour. When I turned to Iris, I was able to increase their pay to $12, $13 an hour, which alleviated turnover. This is a huge issue. Turnover is very costly, and it is very disruptive to individuals with disabilities. So we're sort of concerned about what this means. Again, we really are not sure at this point what it means to have Iris enrolled into family care in the state budget. Okay, James, next. Okay, the family care will include medical care. So it's going to include acute medical care. We have a concern, again, about what this will mean because under the MCO plan, this means that MCOs will contract with clinics. They will contract with doctors, and we're sort of concerned about whether or not you're going to be able to continue to have your doctor that you've been working with for many years. Again, we don't know because nobody's really telling us. There is not really a big plan on how this is going to roll out. The other issue that we're concerned about is under the changes, most or all of the family care's current managed care organizations will not stay in business. Why is this? Well, one of the reasons is because they will be under the Office of the Insurance Commissioner. Under the Office of Insurance Commissioner, there are various regulations, like you have to have a risk reserve, which means you have to have enough money to pay for all of those expenses that you are going to be incurring. That means that many of the MCOs that are currently out there, they don't have that risk reserve if they have to include the primary care. The other thing is that, family care, basically will become an insurance benefit. It's not really going to be a long-term care benefit once the changes take place. We do anticipate that when all is said and done, there probably will be 2 or 3 large MCOs that will be taking over the entire state, and you will really not have your local MCO that you work with right now. Okay, Lisa?
So what is in the state budget? ADRCs and personal care. Aging and disability resource centers may not operate like they do now in your community. The budget proposal eliminates ADRC governing boards and regional advisory committees. $19 million will be cut from personal care, and that equates to about 1 million hours of care in reduction. And there will be a new required independent assessment for personal care. So what does this mean? As many of you know, ADRCs were originally designed as kind of one-stop shop centers to really help people with disabilities and older adults get information about resources and different benefits and supports that would be available in their communities. Under the budget proposals, ADRCs would no longer need to be offered in each county, and services could be provided regionally or on a state basis. Some of these services would be contracted out. Again, as John mentioned, a lot of this is really unclear. We're not quite sure how this will play out. We anticipate that private entities could begin offering services that are currently provided by ADRCs. That could be the long-term care functional screen, and right now that's more of a personal process that happens face-to-face, and we're not quite sure exactly how that will be administered and how those folks will be trained or support people in that process. With regard to the governing boards at ADRCs right now, people with disabilities are required members of that board, and they're important local voices in how decisions are made in long-term care in your community. So getting rid of those boards eliminates a lot of the local voice and input into long-term care. With regard to personal care, under the current Medicaid hourly rate, this equates to about 1 million hours worth of cut in personal care services. This change was made. It talks about how they're trying to eliminate fraud and abuse by bringing in this third party to do these assessments. And so we're not quite sure what the impact of that will be, but certainly people with disabilities and older adults rely on personal care in the state for very basic needs, daily care needs. To get up in the morning, to bathe, to eat their meals. So it's a very important service for people.
Yeah, one of the things that as I'm going out around the state, and in one of my previous lives as a Katie Beckett consultant, if you call somebody and you do an assessment over the phone, you really do not get an idea of what somebody is as far as their functioning ability is. It really helps out when you go and do a personal visit. You see the individual. You can actually see what it is that they're capable of or not capable of. When I was a Katie Beckett consultant, I would go out and I would ask, for instance, the parents, so are your children able to do activities of daily living? And the parent would say to me, well, yes. And then I would ask them a more specific question. Is your child able to brush their teeth? Well, no, they're not able to do that. And so when you think about it, if they are going to be doing these independent assessments over the phone, and again, we don't know if that's what it is that they're going to be doing, they may not be able to get the real good, accurate information in regards to what services your child really does need to have. And that is a very big concern of ours.
So children's long-term supports is another area in the budget proposal that sees some changes. The budget proposal eliminates the family support program. It creates a children's community options program, and it provides additional funding from school-based Medicaid to reduce waiting lists. So as many of you know, the family support program is a very popular and effective program. It's been around for many years. It provides a small amount of really flexible funding to support families whose child has significant disabilities, who meet what they call an institutional level of care. So the governor's budget proposal would eliminate the family support program and create this new COP program. There is an existing COP program that's managed by counties and was designed for individuals with disabilities and frail elders. So I guess the concern is with turning the family support program into a COP program that it does kind of change the identity of the family support program to be less about the family and more about the individual, which is not necessarily a bad thing, but it's something that we are proposing that we need to protect. The flexibility and the identity of the family support program is really supporting families and being a pot of funding that counties can use to meet the needs of diverse families. So again, specifically, families are very interested in preserving the flexibility of the family support program. They want this new COP program to have the same values as the family support program, including a focus not just on the child but on the family, and so that people have really a choice of supports and flexibility. Again, the budget provides for additional money to address the children's waiver waiting list. There are approximately 3,000 children and youth with significant disabilities in their families that are waiting sometimes up to 8 years. So this is really an important change. Again, this is a change that we think can be good for families, and we're just watching it and making sure that it remains a flexible source of funding for families.
And just to explain a little bit more about the Community Options Program as it would be implemented, the one positive with this is currently there is not you cannot carry over funding from the Family Support Program. With the Community Options Program, a county can carry up to 10% over to the following year for the Community Options Program that can be used if you don't use it during the year that you get it. The other thing is that 2 years afterwards, if you still have money left over, it is reverted back to the state. However, it still is put into that Community Options Program funding, which allows the state to have accumulate a large fund for exceptional expenses for individuals that have large expenses for things such as, maybe modifications to housing, those kind of things. With the family support program, the money goes away. And so that's if it's not spent. So that would be a positive thing with the children's long-term care services. Again, the issue is more that we want to make sure that we have the families included with some of the things that you're able to use the flexibility to spend. Okay, and I see that we have a question from, I'll mention your name, Randall Steiner. What kind of people are getting an assessment over the phone? My son is in the IRIS program, and we have always had a person come to our home every year to see him and do his assessment. And Randall, you're absolutely right. Currently, that is the system. And this is where we really have concerns about this budget proposal, is we really don't know. It could be that you do an assessment over the phone. It could be that somebody is coming out and doing an assessment. It could be somebody that is not familiar with you. And, with all of this stuff, one of the things that we say, nothing about us without us, we really do want to make sure that we have a seat at the table so that we can help the state to design a program that works for individuals with disabilities. And that's really the most important thing.
So on to education in the budget. There was no increase in special education funding in this budget, and there was approximately a $150 cut per student across all students. This concern about no increase in special education funding, there has not been an increase in 8 years, and we've really eroded our special education funding from approximately 44%. The state was putting in 44% of all special education costs 20 years ago. We are now down to 26%. So that is a great concern of how that erosion in special education funding over the years really impacts students and families in their classrooms. There's also no fix for open enrollment for students with disabilities. So what that means is often open enrollment provides a choice for families of students with disabilities to choose another public school that they think can better meet their son or daughter's needs. And it's a good choice for families because that comes with all the protections that public schools provide: qualified staff, an IEP, transition supports that are required in federal law. Education stakeholders had come to the table and created an open enrollment fix in agreement with DPI that was included in DPI's budget request, that state agency budget request, and that was not included in this budget. It was a fix to open enrollment that a lot of people agreed with that had absolutely no cost. So it's one of those things we want to keep asking for because it's good for families. There's also no funding for school-based mental health services. School administrators, families, staff in schools agree this is a critical concern, that children need better coordination in their communities across mental health services. That is not included in the budget. Also, a lot of people in the Capitol are talking about accountability. There are several bills in the Capitol that are around school accountability. The governor's budget includes some provisions for accountability. What that means is we're trying to give families some transparent information on how schools are performing and how they are educating different groups of students. For students with disabilities, this means we want students with disabilities defined the same way across different types of schools that receive public funding so that parents can look at the test scores or other graduation dropout data about those students and know if that's a school that they think is equipped to educate their son or daughter. We have
we have another question, and this is in regards to the estimated savings in long-term care, family care. I believe that federal support money approximates 58% of money spent. Where will that money be redirected should this proposal pass in the legislation? And I guess the cost savings that you can estimate are based upon the fact that individuals that live in institutions cost more than those individuals that live in the community, and federal waivers are based upon the fact that you need to show a cost savings versus the living in institutions. That was actually known as the Tax Equity and Fiscal Responsibility Act of 1988, passed, signed by Ronald Reagan, and it was the thing that created the waiver system. So right now, I guess that's the best thing I can.
Well, the major reforms and changes, the upheaval of the long-term care system that John described actually has no savings associated with it. There is a $14 million savings that is included in the budget proposal, but that money comes from expanding Family Care and IRIS in its current model into the 7 Northeast counties. You might remember that the legislature approved bringing Family Care and IRIS into Marinette, Brown, Oconto, Kewanee, Dorr. I'm missing one.
Forest, Violet, Oneida.
Not those,
not
but
those,
there's
right.
7 Northeast counties that were brought into Family Care and IRIS, and that's where that savings comes from, is from expanding the existing system. So the different changes that John was talking about that really are affecting those, 51,000 people in Family Care and those 11,000 people in IRIS don't have any savings associated with them at all in this budget.
Right. Actually, the $14 million that the state is talking about as savings, that's $14 million that will be coming from those counties. Right. And so there really isn't a savings if this happens or if it doesn't. It's $14 million for expanding.
That they will get anyway.
They will get anyway. Exactly. Okay. So.
All right, moving on to some mental health changes in the budget. So there are changes proposed for the emergency detention process of persons for reasons of mental illness, drug dependency, or developmental disabilities. So this is a process that occurs when someone is having a crisis, and it talks about who needs to be present when this occurs. There's some conflict about whether or not this is a good or a bad change. I think everyone agrees that there's not really enough money to implement this in all counties in the way that's intended. There's $1.5 million for all counties to implement. So there's concern that really isn't enough money, but also that all the counties really need to have more discussion about what maybe the unintended consequences of changing this very important process is. The budget also expands Medicaid coverage to residential, non-hospital substance abuse treatment services. So these are provisions that we will be watching very closely. In terms of transportation, there was a 1% inflationary increase in seniors and individuals with disabilities specialized transportation aids to counties, about $437,000. No increase in transit funding over the 2013 budget. Of course, a lot of people with disabilities, older adults, really rely on transit and specialized transportation in their communities. It helps people get to work. It helps people participate in their communities. So transportation really links to all the other pieces of people with disabilities' lives that we think are very important. Transit remains in the segregated fund that protects it from competition with other pots of money. We think that's a very important thing, that money remains in the segregated fund. And also 4 new shared ride taxi systems were created. We think that can have some positive change for people with disabilities in their community. So other items in the budget that people are watching and are concerned about, there are some pretty big changes to BadgerCare. Childless adults in the budget are now limited to 48 months or 4 years of coverage. There's a request to impose monthly premiums on that population and drug testing provisions. So you might recall in the last budget there were changes made to BadgerCare to cover people at 100% of the federal poverty level and lower. So these are people who are very poor. There's a lot of information that says charging premiums to that population is a very bad idea. We need the permission of the federal government in order to make these changes. So some people think that some of these changes won't be approved, but imposing premiums on people who have chronic illnesses, experience mental illness, who are also very poor, these changes could be very detrimental to their health, and a lot of people anticipate will drive them to emergency rooms and other more costly forms of care if they're not able to receive basic health care. There's also drug testing provisions that are being imposed across a variety of programs that people with disabilities use. One that we're also paying attention to is drug testing imposed for applicants for employment services from the Division of Vocational Rehabilitation. Of course, that's where people with disabilities receive their training and support to get a job. And so we really have a lot of questions about, will that deter people from even applying? And we don't really know, what drugs they will be testing for. A lot of people with disabilities do need to use a variety of medications in order to manage their illness. And so they're really, again, with the other pieces in the budget, there's not enough information to know exactly how this will work.
Yes. And we do have a question on how these changes, if the budget is approved, will affect certified 1- and 2-bed adult family homes and certified CBRFs. And I would imagine that there would be an effect, because you would need to, as an adult family home, contract with a MCO. And currently, I know that there are many adult family homes, small adult family homes, that are IRIS homes, and so you would no longer have that ability to get the funding directly from IRIS. You could self-direct, but again, we're really not sure on that, and that is really the most frustrating thing with this, is that we're not really sure. The department is telling us, trust us, and we'd like to trust, but we'd also like to be involved with the development of it, and that's really what the bottom line is with some of this stuff. Okay. So when you're talking about some of these programs with legislators, I think one of the things to talk about, especially with long-term care, is that Family Care and IRIS are both Wisconsin-grown long-term care programs that were developed over 16 years with participants and stakeholders. Individuals that receive services have been involved with the development of these services. The current MCOs need to have a governing board, an advisory board, that actually is made up of individuals from the disability community and the aging community. That's really important. Again, I keep on saying nothing about us without us, but we really need to make sure that people with disabilities and individuals receiving services are sitting at the table when these decisions are made. Now, the current system is also an investment in independence for more than 50,000 Wisconsin residents. We know that under the proposed system, there will be several of the MCOs that are currently out there that will no longer be around. And we're concerned about those potential changes. Individuals receiving services really need to have consistency. And right now, from everything that we're hearing, people are doing pretty good with the system that we have right now. So,
and a majority of the people in those systems are people with disabilities.
Exactly.
So our systems are unique in Wisconsin, and actually, nationally renowned. People come to Wisconsin to learn about our long-term care system. And, we serve older adults, we serve people with physical disabilities and people with developmental disabilities within our system, and that's very unique. We've eliminated waiting lists. That's very unique. And, I think a lot of us are saying what's broken.
Exactly. And I see that we have another question. It is my understanding that IRIS daily rates for adult family homes is much higher than family care rates. Will any attempt be made to level out across the state according to the needs of individuals being served in the state? Or will AFH and CBRS be at the mercy of the insurance company deciding reimbursement? And again, this is a question that we are really not sure of. And it is true that if you are given the amount of your funding and you can direct where that funding goes, you will know exactly what it is that you have available in your budget. But we are not being given any assurance about anything, to be very honest.
I think these are very important questions for people to pose to policymakers, because I think that, as you saw, as John was talking about the history of our current system, stakeholders were at the table. They took years to kind of think about how it would work and what maybe some unintended consequences are. And so when we don't take the time to really, we're going to overhaul an entire system that already has more than 60,000 people in it. I think it's important to slow down the process and really ask some of these questions, because whether or not it is a good idea to change the rates and the way the questioner asks, we don't really know. But we don't have time between now and when the budget is supposed to pass to really vet questions like that plus multiple others.
Yeah. Okay. Then we have a question. Can you define transit?
So transit's our bus system that exists in communities across the state. So those are, the kind of the public bus system that people use and anything connected to that public bus system.
Okay. Okay. Any idea of the members of Joint Finance that are likely to be considered favorable to keeping the long-term care program maintained, including IRIS? I would say,
all of them.
All of them. We will talk in a little bit about what you can do, but it is important that we're connecting with all of our legislators and all of Joint Finance committee members, because unless they hear from us, they're not gonna. There's not going to be changes within this budget. Okay, let's move on to the next slide. So, in regards to long-term care, IRIS is not just an option or benefit. It is a program that supports self-determination. It is a program where you can actually go out and use the funding that you have allocated to you to live a life. And a lot of times, people that have their full IRIS budget don't use the full budget. And that's the beauty of it. If you have control of the funding, you're more careful about how it's spent. Because at the end of the day, you want to make sure at the end of the year, you've got more, you've got enough money to make it through the year. Family care and IRIS have reduced costs and kept people living in their homes and communities. And that also is another really very important thing. People want to live where they want to live, and we want to make sure that we can support them in living in the places that they want to live, so that they can be a bigger part of society in general. Again, we talked a little bit earlier about the budget saving, the $14 million savings from the statewide of family care. And this is not from the elimination of IRIS, and is not by making changes to family care. This is because the 7 counties are coming in from the northeast right now, and the money that they have spent from their county taxpayer dollars to support individuals with disabilities in their local community is going to be transferred over to the state, and gradually that number will be reduced. I think it's like 20% a year over 5 years, so that that will come off of the property tax rolls, but the money is going to be there whether or not family care and IRIS are there or not. So that doesn't matter. And also the changes to family care and IRIS could disrupt your care, and that's one of the things that we were talking about. We're really concerned about disrupting individuals' care. We want to make sure that individuals are getting good care and are living the lives that they want to live. And finally, we talked a little bit about the doctors and providers. I was up in Hudson a couple of days ago, and when I was there, people mentioned the partnership program, which was one of the programs that was available that had acute care in the program. What individuals told me up there was that when they had the partnership program, as far as in their managed care organization, it eventually got to the point where there were only 2 clinics that they were able to use. One was in Ellsworth, one was in River Falls. Well, guess what? Ellsworth and River Falls are not the biggest communities in that particular area. So individuals really were forced to go to doctors that were, first of all, many miles away, and second of all, that they may not have had any history with. So we are really concerned about the ability to use your Medicaid card for card services if the system of the CMOs come in with managed care with insurance companies. Okay. So, okay.
Was there a question?
Is it the same training that is being offered in Milwaukee on Thursday?
Yes, it is.
If these budget changes are approved, will I be able to employ my current caregiver directly without special network or certification requirements, or will I have to pick one in a network or use an agency?
And again, we're not sure, but I would imagine that with these larger insurance companies, that they will be wanting to contract with somebody that is going to be then hiring your individual.
And we apologize that we have to say that we're unsure, because really there are not a lot of words on the paper giving detail about how these things will be implemented, which is what is really raising our concern level about these sorts of really important questions about, can I keep my doctor? Can I keep my caregiver? Can I keep my employment provider? I mean, really, the way it's designed, and when we look at other states that have similar programs, it comes down to, will your provider, will your doctor be in the network that's being offered by this new insurance company? And I think we won't know that until we see those plans. And so that's why it's important to say, I want a place at the table. These are big changes that affect my daily life, and I think that they should be slowed down so that I can participate.
Exactly. And what is the old saying? If you're not at the table, you're what's for dinner, right? We don't want to be dinner. We want to be at the table. Okay, so what can you do to affect the budget? Okay, well, first of all, you can speak up. It's really important that you talk to your legislator either at the Capitol or in your district. Now, legislators oftentimes are in the district on Mondays and Fridays. And that's a good time to go ahead and call them up and say, hey, would you like to have some coffee? And tell them your concerns. Tell them your story.
Find out their favorite coffee shop. So that link up there, that's the legislature's website, and that there's a page right on the front page where you can enter your address. So if you don't know your legislator, or maybe you're not sure, sometimes the map changes, you just want to double check, you can go right to that website and put in your address and find out who that is. Gives you all the contact information. I think we recommend meeting in the district is often the best time to have a really good conversation with your legislator. They put their pants on just like we do.
That's right.
One leg at a time.
Yes, or their skirts, whatever.
Right.
Okay. Also, we would encourage you to attend Disability Advocacy Day, and that is next Tuesday, March 17th. It will be in Madison, and we will actually have set up appointments for individuals to visit with their legislators with a group in their office. You know, the other thing you can do is you can write a letter to the editor. I mean, in small towns, like, for instance, in River Falls, where they have the River Falls Herald, I believe that's what they have up in River Falls, that's a once weekly newspaper. And by writing a letter to the editor, what you're doing is you're not only educating the community, but you're also reaching out to your legislators. Legislators have what they call clippers. What they do is they go through all of the local newspapers, and if they see something where somebody is mentioned, like a letter to the editor, they'll clip those letters out. And you can be guaranteed that they will notice that there is something going on in their community. So it's really good to write a letter to the editor, both for educating the community as a whole, and also to send a message to your legislator if you are not meeting with them. But we also encourage you, definitely meet with your legislators. Okay.
I would write to the Horicon Reporter.
Oh, you would write. Oh, yes.
Right.
And I would write to the Hudson Star Observer.
Oh, okay.
Yes. Okay.
So the next big opportunity are these joint finance hearings. You remember in that chart I showed you earlier, we're in that part of the budget process where the Joint Finance Committee, which is a budget committee of 16 people from the Assembly and the Senate, who are charged with looking at the budget first. And they go out to the public and they host these public hearings in different towns across Wisconsin. They try to be accessible locations, but oftentimes they aren't. But our organizations will have tables set up to help people, to greet people, to support people who want to testify. It's also a good time to just come and listen and to show your support for other people who are testifying. So you see up on the screen, there's 4 different locations coming up. We have one in Brillion, Wisconsin at Brillion High School. That's on March 18th. That's in the Fox Valley area, just south of Green Bay. We have one in Milwaukee on March 20th at Alverno College. We have one on March 23rd in Rice Lake, and then one on March 26th in Reedsburg. If you aren't able to come to one of those hearings, you have other options to give your input as well.
Right. And just to give you a little bit of a warning about Joint Finance Committee hearings, they oftentimes are very long. You have to remember that there are going to be many people, maybe hundreds of people, that are going to be giving testimony about all different aspects of the budget. Now, it can be very fun, too, to observe some of the different people that are speaking. When I was in Baldwin last year, there was a guy that actually got up in a potato sack. We called him the potato sack guy. And he gave a very interesting piece of testimony. But you can sort of have fun with these, and you can learn about all different other things that are involved with the budget. But again, be very patient. It may take a long time for you to get up to speak. The important thing is that you're getting your word out on the issue that is important to you.
So again, if you can't come, you see that email address up there, budgetcomments@legis.wisconsin.gov, or you can always go old school and write a handwritten letter to the clerk of the committee, Joe Malkazan. I think that's how you say it, at room 305 East in the state capitol, Madison, Wisconsin, 53702.
Okay, let's see. I think that there's another question. I reviewed the DHS recommended last fall for increases in long-term care, but now that our governor has proposed his budget bill, the DH secretary now seems to endorse the governor's proposal. Any insight why such a turn occurs? And I really don't know.
It is, the Department of Health Services also issued a sustainability report in December of 2013 talking about how we were on track for sustainability in long-term care. They were working on improvements. One of the big things that they talked about was an investment in community employment and helping young people to become young people with disabilities to secure community employment was one of their ideas toward sustainability in the system. They had other ideas, and so we were really on track for success and savings and sustainability for both people with disabilities and older adults. And as you also know, the recent decision to bring in those 7 Northeast counties, there are people today who are enrolling in both the existing family care and IRIS programs in those counties. And so it seems strange to us that we're kind of shifting plans midstream. And I think, again, those are the kinds of questions that we suggest that you ask to your own legislator, because I think those are the questions they should be asking the department as well.
So we have a few recommendations about how you can talk to your legislator. Okay, the first thing is make sure you give a clear message. And a lot of times it's good to practice saying it before you actually present it. I mean, sometimes I get a little bit frustrated and I screw up. Yeah, so practice. That really helps out a lot. Know the basic information about your issue or program you're advocating and how it affects you. Really make sure you're telling your story. Tell the story of how the specific piece in the budget affects you. That really is important. And remember, every time you meet with a legislator or a staffer, you're building a relationship. Relationships need lots of regular contacts over time. So don't just be, as a long-term strategy, don't just be going to your legislator when you want something, but, talk with them about just things. Thank them. A lot of times legislators don't get a thank you. 2 years ago, Luther Olson, a senator, walked out of the budget hearing, and I have to be honest, there are a lot of things I don't agree with Senator Olson about, but I really appreciate his efforts in education. And I said to him, thank you, Senator Olson, for your help with all of the education issues that we've been facing. And he looked at me and he said, nobody ever thanks me. And I said, and he really appreciated. We sat and we had a nice little chat for 4 or 5 minutes. But thanking legislators really helps out an awful lot. You're trying to establish a relationship with them.
You know, and something about what you said about tell your story, I mean, that's really what legislators tell us they remember, is you can have all the facts and figures in front of you, you know, how much Family Care and IRIS have saved and how much it will cost to make these changes. And what they'll really remember is how you use the program, how Family Care or IRIS helps you get up in the morning or has helped your son or daughter to be able to live more independently, how it's helped you to maintain your job as either a caregiver, or how it's helped your son or daughter to light up by working or by being part of something in the community. Those are the sorts of things that they're actually going to remember. And the other point about relationships, I mean, sometimes you can get frustrated or angry with your legislator, but oftentimes you have to remember that your role is really educating them. And so by showing them a little sneak peek into your life, and we know parents who've invited their legislator to IEP meetings, and it's been a really great awareness experience for that legislator to actually see how, you know, teachers and parents sit around the table and problem solve for quality education for their child.
You need to remember that legislators are dealing with a ton of different things. They're dealing with roads, they're dealing with everything. So they don't know everything about everything, and it's up to us to teach them.
Right.
You know. So the other thing is to make sure you ask for what you really want from your legislators and be very clear. For instance, I want more funding for, or I want the current changes to be taken out of the budget, or whatever the issue is that you are talking about. You know, my girlfriend a couple of weeks ago said that we got in a fight, and I didn't realize it because she was sick, and she called me up, and I said, "Can I get anything for you?" And she said, "No." And the next day she said, "You know, we were in a fight." And I said, "Why?" She said, because you didn't bring chicken soup over to me." And I said, "I didn't know."
She needed to ask
She needed to ask me. So
we need another webinar on that.
Yeah. So the thing is, really make sure that you ask for what you want. Legislators can't read your mind. Okay.
Good point.
And remember to listen as well as talk. A lot of times when a legislator is asking you a question, what they're doing is they're trying to find out more information. So make sure you're listening to them so that you can answer them accurately. That's really important. So when a legislator or staffer raises an objection or question about your issue, you know, stay calm, be polite. Don't feel you have to answer right away, and definitely never, ever, 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 ever lie.
Or fake it.
Because if you do and a legislator finds out about it, you lose all credibility. Be very honest. If you don't know the answer, say you will get back to them about the answer. You can contact us or other individuals that may know the answer, and we can help you to get that. But don't. Please don't fake it.
And I think, you know, you're going to be nervous in those meetings, so often think about what piece of paper you might be able to bring along that supplements your conversation and that you can leave behind and that might have that answer on there. So, but again, I think just a promise to follow up is always a good piece of advice.
Absolutely. Okay, and do we have another question?
We do.
Okay.
Somebody asked where the address for.
And I saw that a kind replier entered the address for us. So
Excellent.
somebody's wondering about the address for the Reedsburg Joint Finance hearing, 1100 South Albert Avenue in Reedsburg.
My legislator said, my quick research has uncovered that the intent is to not change the benefit system as is currently employed, meaning the goal is to keep the recipient in their homes. The other concern is that there has been fraud, that they're identified in the current program. These changes are an attempt to weed out that out. And I got to tell you, I never heard of any insurance fraud ever. You know, the issue is that there probably is a very, very, very small amount of fraud. But when we have asked the department to give us specifics, can you give us specifics about the fraud? they have not been able to really give us anything about where the fraud is. And so I think that that's one of the things that you can ask your legislator. If they say, well, I heard there's a lot of fraud here, you can have them ask the department
for the data
on the fraud. Okay? Then the next, I've been assured that there will be no changes for the next 18 months as these modifications are being debated. Well, the reality is this, is that we don't know.
Well, and I guess, we've been saying, do people remember LogistCare?
Mm-hmm.
LogistCare was a statewide contract for non-emergency medical transportation that the state implemented, and I think by all measures it was pretty much a fiasco. And so what's being proposed here is within 22 months to bring the entire state, all 72 counties, into an entirely new system for all of people's long-term care services. That's too big of a change, too soon, and if LogistCare has taught us anything, it's that it's hard to change over one service, not an entire system, is what is being proposed here.
Right. And I think also to remember that when family care was first instituted under Governor Thompson, many, many years ago, we started with 4 pilot counties. We increased region by region until we got to the point where we're at now. We did not do that over 18 months. We actually did that over almost 18 years. And so it's important to understand that this massive change so quickly it would be unprecedented. It really could cause a lot of havoc. That's where our concern is. Okay, anyway, we've got some more ideas for talking to your legislators. Make sure you can have handouts to hand out to your legislators, but you need to make sure to be clear and to the point, and make sure you read them first and you know what's in them, because if you don't, and a legislator reads this or their staffer reads and asks you questions, giving you a quiz about what's on the paper and you don't know, it really does not look good.
Just be comfortable with your material.
Exactly. Don't give up. Keep up the contacts until you get a real answer. Met a guy in Green Bay the other day, and Bubba told me I'm going to call him up every week, once a week. And they're going to get to the point where when they hear my name on the phone, they're going to be sort of scared because I'm calling. I said, well, Bubba, what do you mean? He said, I'm going to call them until I get an answer. And that's important.
Your best advice about, developing that relationship with your legislator is that they start calling you and asking you for your advice or input. I was just talking to a legislator the other day, and I said, well, there's a person in your district that uses Iris and family care. And I think, oh, Ginger, we know Ginger. Like, when you're on a first name basis, you know that you've done a good job with this relationship and being persistent.
Absolutely. And of course, broaden your base. It's not just individuals with disabilities that are looking at these long-term care changes. There are the individuals who are elderly. There are a lot of folks that are looking at a lot of these different changes. Transportation, same thing with transportation. It's not just individuals with disabilities. There are a lot of people that really, really are affected by some of the transportation issues, education, all of these different issues. So make sure that you're trying to connect with other people that are concerned about the issue that you're concerned about and build a much larger coalition. Okay. And of course, remember to say thank you. As I said earlier, a lot of people don't get thank you. A lot of legislators don't get thank you. They only get complaints about what's going on. Thank you goes an awful long way, especially with a legislator. So definitely make sure that you're saying thank you when they take the time to talk with you, or especially when they do something that you really appreciate.
Right. And don't get discouraged is the final point, because change takes time. I've worked with a lot of advocates that have introduced the same bill, the same policy over and over again, and you feel like you failed, and then you just get right back up. So I think that this is the sort of budget where you are going to probably need to make persistent calls and to not get discouraged when you don't get that answer right away.
Okay. So we have another question. Was IRIS mandated by the federal government? Self-direction under family care is very different from IRIS. Can the federal government intervene if IRIS is eliminated? Well,
I think I was required as an option to managed care at the time that it was created because there was no other managed care organization choice in regions across Wisconsin. So what's being proposed now is that people would have choice between different HMOs as their choice within a region. And so it's really unclear what role the federal government would play in. They, of course, have to approve Wisconsin's plans, but once the budget passes, we're kind of at a different point of public input. So I would say, I'm not sure, but it's unlikely that the federal government would not allow Wisconsin to eliminate the IRIS program.
Yes. So, let's see.
So we just have some follow-up resources here before we take some additional questions. So if you've heard anything of interest today, but you want some more information, a good place to look is on the Survival Coalition of Wisconsin Disability Organizations website. So you have a really full, long link up there, but if you just go to www.survivalcoalitionwi.org, you're going to find a lot of really good information. I would look for the Disability Advocacy Day issue cards. The Survival Coalition has more than 30 member organizations, and there are different issue teams that write issue cards about transportation, about education, about employment, about long-term care and children's long-term supports. So you'll find more detail on that website. Also, it's good to remember to continue to contact the Office of the Governor. That website up there goes right to a page for Governor Walker phone number and email contact, and you can make sure that the Governor's office understands your questions and concerns about the budget as well.
And you know, for our shameless plug, which I always do at the end of these sessions, is the Wisconsin Board for People with Developmental Disabilities has a web page. We have many different resources there, as does Disability Rights Wisconsin. So if you have some questions about some of the other things going on, please visit either one of our web pages, and you hopefully can get the information that you need.
So that directory of 2015 Joint Finance Committee members is a really nice document that has the actual pictures of the 16 Joint Finance members with their phone numbers and emails. So those people are really important right now to get calls into and to email along with your own legislator. So those are the three people that I definitely would be connecting with would be my assembly person, my senator, and my and the Joint Finance Committee, which we provided the contact for previously.
Okay. So, we
have a question?
I guess one of my
legitimate concerns is the proposed private out-of-state insurance oversight agencies may attempt to reduce benefits to participants with the underlying goal of increased corporate profits for them. I mean, I think, again, because there's not a lot of detail in the proposal, when the Department of Health Services provided testimony to Joint Finance Committee members last week, they talked about their desire to have 2 to 3 statewide entities coming into the state to provide this benefit. And so I mean, it really remains to be seen what their networks will look like, what the supports will look like. The department has said they want to keep the existing family care benefit, but the detail is not in the budget bill.
And I guess one of the other concerns is the RFP process under the budget.
Request for proposal.
A request for proposal. The department does not need to submit a request for proposal unless that's changed. I'm not sure it has. So they could.
So this is not a competitive bid.
This is not a competitive bid. The department can go ahead and just award the CMO, statewide CMOs, to whoever they choose to do that without a competitive bid. And it really is good to have a competitive bid so that you can really read the proposals and the people tell you exactly what it is they're going to provide. So that's another concerning area that we have. So,
well, it looks like we're out of questions, unless anybody wants to type something in.
So, I guess with that, thanks for tuning in. This is going to be a video archive, so if individuals would like to see this and get more information, you can, again, go to our web page or our Facebook page, and we will definitely make sure that we have a link that you can share with others. Otherwise, thanks very much, everybody.
Thank you.